sex and reproductive health. How should it be taught in schools? Should it be discussed in schools? How should the federal and state government allocate money to various techniques and programs? This is a topic which has not received much buzz in the media or discussion in government, but is a topic that needs to be addressed. Dr. Kara Jones and Ms. Linda Miller spoke of the benefits and drawbacks of various reproductive health education methods.
It is imperative that students receive education on both their physical reproductive health as well as how to use the appropriate methods to be safer sex and contraception.
And in 1993, the World Health Organization basically created documentation and collected data that abstinence-only education doesn't really help to identify with protecting against STDs and HIV.
The National Institute of Health came out with a study in 2009 which looked at abstinence-only education. The idea being to sort of only give education on abstinence until marriage, and it is correlated with an increase in teen pregnancy rates and sexually transmitted diseases. It not only does not decrease teen pregnancy rates, it is likely and been associated with an increase in it.
Hempfield's Health and Physical Education Department Supervisor Dr. Mark Ashley described the current curriculum here at Hempfield.
We feel comfortable with the approach we're taking now because we think it's the best thing for our students to have all the information available to make sure it's being taught from a certified health educator. And then we do challenge them to have conversations with their parents and to really think through the information that they're given to evaluate for themselves what they think is best.
I've been here 30 years, and when I first came, it was abstinence-only education, and that's what was taught here. Hempfield adopted and approved comprehensive sex ed to include a broad-based curriculum that incorporates the prevention of disease and illness related to relationships, interpersonal communication, and risk factors.
So the health education curriculum is actually dictated by the state standards of Pennsylvania. So the Department of Education has standards that are evaluated at grade 3 and grade 6, and then again at the high school level, grade 9 and grade 12. And so we need to be able to hit each of those key components of the state standards at each one of those grade levels. And so as it relates to health education, we address all the state standards in our curriculum, and then those things need to be, when they're revised or edited, they need to be taken before the school board, because the local school board has some say as to the way those standards are addressed as well. So it's a combination of state, federal, and the local Board of Education.
Senator Ryan Ament of the 36th Senatorial District discussed the issue of abstinence-only education versus comprehensive sex education in Harrisburg.
That specific debate between abstinence-only sexual education or safe sex education, that has been, and again, I think it's appropriate that be left to local communities, families and school districts, local school districts to make that determination, because it may be that there's not sort of a one-size-fits-all approach when it comes to sexual health education, and that varying communities, different communities across the Commonwealth may have different needs and may also certainly have different views. And I think that's best reflected by local decision making.
As the issue of safe sex in schools remains stagnant, I wish to remind the viewer that if you want to show your support or you seek change, contact your local congressman. For Hempfield Happenings, I'm Orion Jones.